Saturated fat and trans fats are the fats that have primarily been implicated in the development of cardiovascular disease and hypertension. Trans fats are commonly found in processed foods, and they have a very long shelf life, which is why we see them more frequently in foods. Trans fats and saturated fats, when we eat them regularly, then they can influence the risk factors for cardiovascular disease, particularly LDL cholesterol. It's hard to separate cholesterol from dietary fat, that both of those together play a role in the development of atherosclerosis. Atherosclerosis is the thickening of the vessel walls and the hardening of the vessel walls, and that interferes with the vessel's ability to dilate and constrict, which needs to happen in normal blood pressure control. Dietary cholesterol and saturated fat both play a role in the thickening of the walls. So keeping both your dietary cholesterol as well as your saturated and trans fat intake to a minimum level is very important. Saturated fats and dietary cholesterol come primarily from animal sources. So the meat that we eat, the dairy foods that we eat, milk, ice cream, cheese, those are the sources that we find most of those fats in. Because fruits and vegetables and low-fat dairy foods are essentially void of trans fats and extremely low in saturated fats, and the nutrient and fiber content of those foods, then that's why a diet rich in fruits and vegetables can be very cardioprotective.